Hello, I'm Bob O'Donnell, Superintendent of Schools. Thank you for taking time to hear our update regarding our plans for this fall. Today we'll discuss an overview of our draft Pandemic Health and Safety Plan. Because the plan includes safety parameters that impact what we are able to do in schools, we're going to address questions parents submitted that focus on in-school experiences and what they'll look like related to our educational model. Looking ahead, once our Pandemic Health and Safety Plan is approved by our board, as required by the Pennsylvania Department of Education, we will be sharing more information about our educational model plans for elementary and secondary options. And then we're going to ask our families to make a decision as to enroll their children in our schools this fall or opt for our virtual academy. We will also be posting this information to our website in the near future. Prior to sharing an overview of our health and safety plan, I just want to reflect on the fact that the key constraints in the plan are based on recommendations from physicians, including our district physician, who is a pediatrician, epidemiologists who are studying evidence regarding the spread of the virus, and our certified school nurses who've been working with our Director of Student Services, Jeanne, to lead the development of this plan. Central to the plan for in-school learning, we will maintain social distancing at 6 feet, and faculty, staff, and students will wear masks. Both measures are critical to ensuring safety for all students and employees and the effectiveness of our contact tracing. As far as how this impacts families, we are developing two options, in-school and our virtual academy. Many people have been asking why elementary students are going to be in school every day and secondary students every other day. This pertains to adhering to safety parameters in the plan, specifically 6 feet distance between everyone who's in the building. In elementary schools, we're able to be in school every day because students stay mainly in one room for most of the day. Due to enrollments and class size, we can ensure 6 feet of social distancing. This is also a high priority because, by and large, elementary students are less able to learn independently than most secondary students. In secondary schools, we have a higher average of students in many of our classes as well. This, combined with the fact that secondary students move throughout the day in the building several times, are the main reasons why we need secondary students to be in schools every other day. Now, a few words about our virtual academy option. For families who desire for their children to learn from home, we are providing enrollment to our virtual academy. Please know this is different than what your child experienced this spring with our emergency remote learning plan. You might ask, why should I choose the SCASD Virtual Academy over a cyber charter school? Number one, an important change we've recently made, our program now involves learning with SCASD faculty members, all of whom are 100% certified in their content areas. In our academy, you also have access to all of our support services, such as counselors, psychologists, and our integrated mental health services. We also are using a standards-based curriculum instruction. Also, these students will have full access to all of our extra and co-curricular experiences that are offered virtually. Moreover, our teachers and counselors will help you and your child with the future transition back into our rich programs. Ultimately, if you graduate from our virtual academy, you'll earn a state high diploma. With me today are Jeanne, our Director of Student Services, and Ed Poprik, our Director of Physical Plant. They're going to help share an overview of our plan to date, and at this time I'm going to turn it over to Jeanne. Thank you.
Thanks, Bob. As a pandemic coordinator, I would like to first thank the safety planning team for their time and effort that went into the development of this plan, which to date includes over 45 meetings and over 135 hours of work over a 3-week period. Throughout the development, the overall goal of the safety planning team was to get students, faculty, and staff back to school safely. Our primary focus of the team has been on reducing the risk of spreading the virus. With this goal and focus in mind, the safety team has recommended the most restrictive guidelines in the development of this plan. Our intent is to monitor closely, and once we have a better understanding of how the virus will impact us with the inclusion of the PSU students population to our community and incorporating the face-to-face instruction, we can make informed decisions with less restrictions when possible. Please note, once school starts, the safety planning team will continue to meet every 2 weeks to reevaluate the plan and make adjustments, taking into consideration all the district, family, and community factors involved. We will now review the draft phased school reopening safety plan document. To get us started, I would like to hand it over to Ed Poprik, the Director of Facilities and Grounds, and provide a brief overview of our cleaning, sanitizing, disinfecting, ventilation processes included in this plan. Ed?
Thanks, Jeanne. Certainly cleaning, disinfecting, and maintaining our buildings is an important aspect of our reopening plan. The first point I'd like to make is that we as a facilities department continually monitor guidelines from the Department of Health as well as the CDC to make sure that our practices and procedures are in line with the current recommendations. We've done this in preparation of the plan and will continue to do it throughout the school year to ensure that our plan meets all of the necessary guidelines as they exist at the time. Speaking first about specifically about cleaning and disinfecting, our custodial staff is committed to complete disinfection of every building every night. We have the tools and materials in place to do that, and that will be a cornerstone of our plan. In addition to that, we are going to do more cleaning and disinfecting throughout the day than we normally would do. If we have after-school activities with our student groups, we will disinfect those areas at the end of the school day so that when students change and the after-school group comes in, they'll have a disinfected area to conduct their after-school activity. We're going to increase cleaning of bathrooms and locker rooms to 3 times a day. And we're going to work on high-touch areas to make sure that they get more than the standard cleaning. Even with all that cleaning and disinfecting in place, we are going to make some adjustments to our facility usage to help with this monumental task. One of the things we will be doing is closing our water fountains around the buildings. With the amount of student use of those fountains, it would be very difficult to ensure that they were disinfected with enough frequency. We do have water bottle fillers in all of our school buildings, so we're going to encourage the use of those as they are no-touch fillers. In some of our buildings, we will be adding additional bottle fillers to help with the demand there, and trying to keep students hydrated in the safest possible way. We are going to have recess and use of playgrounds. However, to start the school year, we are not going to use the playground equipment, at least for the first 2 weeks, as we evaluate how the use of the outdoor facility progresses, as well as evaluate our ability to clean and disinfect components of that outdoor equipment. So after 2 weeks, we'll look at our playgrounds and make adjustments as needed to best allow this important resource to be available for the students. And we are at this point recommending the closing of our school buildings to non-state college area school district groups. We do have a great partnership with many clubs and other nonprofit groups who utilize our buildings when we are not using them. However, considering the current status of the pandemic and the Herculean effort it's going to take to keep our buildings clean and disinfected for our own use, we think it's prudent at this time to temporarily halt the use of our facilities by other groups so that we can stay focused on providing a clean, disinfected school for our students as our top priority. Obviously, this is not a forever decision, and we will monitor that as things progress throughout the year. We've committed to supplying more essential materials that we haven't done in the past, such as facial tissue in the classrooms, and making sure that hand sanitizer. We will encourage hand washing, but we also want to have hand sanitizer available in key locations so our staff and students have multiple opportunities for their own personal hygiene. And moving from our cleaning and disinfecting and thinking now about our ventilation and HVAC systems. We will, since our buildings have been dormant for quite a while, we will make a complete flush of all of our systems, both domestic water and HVAC air exchange systems, to make sure that we are clean and operating properly and ready to go for the first day of school. One of the recommendations that has come out from many of the groups is that outside air is a healthy piece of indoor building management. And many of our classrooms have windows. And we will monitor times that it's appropriate to open a window. We'll have to be careful to monitor allergen levels to make sure that people with allergies or asthma aren't adversely impacted. But we will monitor when it is appropriate to use our windows to help with our ventilation. And we will also increase the amount of outside air that our systems themselves are bringing in to the classroom. In places where we don't have operable windows, we will evaluate ways in which we can supplement our HVAC systems to do either more air exchanges or potentially have some HEPA filtration of air that's being recycled in those specialty areas. And we are working with with engineers on our team to evaluate places in addition to all of these areas that could be improved, could improve the indoor environment. Finally, humidity has been somewhat linked to the ability of the virus to be transmitted through aerosol droplets. So we will monitor humidity to try to maintain a 40 to 55% relative humidity in our buildings, which is ideal for comfort as well as keeping the ability for aerial transmission at a minimum. That's the basic overview, and I'll turn it back to Jeanne.
Thanks, Ed. The next section of the plan includes social distancing and other safety protocols. There have been many questions related to the American Academy of Pediatrics in reference to the 3-foot, 6-foot social distance recommendations. The Health and Safety Planning Committee, which includes local pediatricians, is recommending a 6-foot social distancing where feasible, as recommended by the CDC, for the following reasons. The World Health Organization adopted the 3-foot guidelines based on research conducted during the 20th century that determined 3 foot is the minimum distance needed to reduce chances of infections for pathogens like bacteria, meningitis, and rhinovirus colds. After SARS-CoV-1, another virus that is closely related to a novel coronavirus, broke out, several studies suggested that a standard 3 feet distance might not be enough. Those studies hypothesized the droplets might have spread as far as 2 meters or about 6 feet. As a result, during the 2009 H1N1 influenza outbreak, the CDC officially expanded its guidelines to recommend the minimum of 6 feet of physical distance between providers and patients, a recommendation that still stands. To fulfill the 6-foot requirement, we have investigated classroom layouts and the number of students that can be in a classroom. Once we have parent choice related to the educational model, we will investigate further how to implement this recommendation where feasible. The next section of the plan addresses lunch services. We anticipate increased number of free and reduced lunch. Taking this into consideration, with the increase of waste as a result of the FDA requirements to take full meal, increase in documentation required for free and reduced lunch distribution, and the ability to socially distance during lunch and sanitize processes needed in between lunch. Some classes will eat in the classroom and in some schools, while others will utilize cafeteria and practicing social distancing. Students who will get school lunches will either have the lunch delivered to their classroom or will be escorted to the cafeteria for pickup. Signage throughout the building will be provided as reminders to fight germ prevention, for appropriate mask wearing, social distancing, and COVID symptoms. Next, we'll address visitors. Visitors will be reduced, and we are going to try to do that by encouraging virtual meetings as much as possible. We will require COVID screenings prior to entry, and we also require mask and social distancing. The offices will also have extra masks as needed for visitors who don't have them. Recess and physical education. We will have inside will require mask and social distancing, outside no masks and social distancing, and we will require frequent hand washing and sanitizing of shared PE equipment when it can be implemented. Sharing materials throughout the school day, we hope to provide individual materials where possible and sanitize after use of shared materials. When we're talking about transportation, this is kind of a work in progress. It will follow social distancing. If we do that, we can only get up to 12 students on a bus. This would increase the morning bus route of 131 buses just to get elementary students to school. With that in mind, we will look into other options, including surveying families who might be able to transport their child, which would result in a revised traffic pattern at school for drop-off and pickup, and also looking into family members sitting together and possible COVID-friendly neighbors. Monitoring students and staff health. We will develop the screening and monitoring systems. We are looking into a daily self-screening process for faculty, staff, and students. Information will be provided on how to conduct the screening process, in addition to frequent reminders of the requirement. In discussion of isolation rooms, they have been identified in each building with explicit protocols for students and staff on symptoms identified for need to report to the isolation room. We will look for staff support to help manage numbers when nurses cannot be in two places at one time. For quarantining, if COVID positive, all exposed will be notified to quarantine for 14 days. If just COVID symptoms, we have been instructed to exclude for 10 days unless come back with a COVID negative test or a note from a physician. To monitor exposure and contact tracing, when students or faculty or staff are sent home with symptoms, we will document contact tracing questions to implement quarantine processes if needed. All spaces will be sanitized as discussed in this section of the plan. Communication to faculty, staff, and families of positive case, immediate notification of all at-risk people of exposure and quarantine, and notification to school and district faculty and staff and families. Other considerations for students and staff: face coverings by all students and staff. Every physician and epidemiologist recommends that masks must be worn. Otherwise, we are unable to contact trace and would likely have a wide impact on quarantines in schools based on potential exposures. Protecting higher risk students. Through survey and parent notification, we will identify high-risk populations and work as a team to develop an individual health plan when needed. Unique safety protocols for students with special needs. The needs of all students with documented complex needs or other vulnerable individuals will be addressed through their school teams. This concludes an overall brief description of the 52-page SCASD draft phase reopening health and safety plan, and I'm going to turn it over to Chris.
Okay, Jeanne. The first question now will begin to address the questions that have been submitted. The first question for you, Jeanne, is the SEAL program returning?
So the health team is going to work closely with the SEAL coordinator to develop a safety plan so that we can implement the SEAL program utilizing the safety protocols needed to do so.
And how does this plan affect the ensemble music classes and programs like band and choir?
Once the safety plan has been approved, individual classes will develop details related to the implementation strategies following the safety guidelines. If these safety guidelines cannot be followed, they'll look into other options like virtual.
If teachers travel during the school year, particularly in the beginning, will they be required to quarantine for 14 days? And will families who travel outside the state be asked to quarantine as well, if that's to be the policy?
If we're made aware of this, we will work with them on a quarantine protocol.
You've stated that we should go into yellow. Our students will be fully remote. Can you explain why students cannot continue attending school in yellow with safety protocols in place? PDE guidelines suggest school could continue in the yellow phase.
We're actually going to revisit that part of the plan and discuss how we can make that happen, taking into consideration the availability of staff and the rapid spread of the virus.
The next person would like to know, how should parents and teachers distinguish common cold symptoms from COVID-19 symptoms? Will every sore throat, cough, etc. require testing? And in addition, if one sibling has symptoms, will all students in the family need to be quarantined and tested? And then the third part of this question is, will parent volunteers be allowed in the buildings?
Okay. We plan to limit the number of parent volunteers in the building as recommended by CDC. Virtual meetings will be recommended as much as possible. We will distinguishing between cold and COVID, we're recommended that we really can't do that in the building level, and that we would omit based on the symptoms. We would also pull siblings down to screen them and omit them so that they can be under observation also. As far as testing for the student, that would be a family decision. The district does not have the ability to test for COVID positive.
Does the symptom checklist for us state fevers above 100.4 degrees? There are many people that may not be aware that they have an elevated temperature. And they should check at home daily. And can the district provide thermometers if families need them?
Sure. So the symptom checklist does include a fever of 100.4. Looking at this, we will provide screening for those and reminders. We will also have the opportunity to look into providing thermometers for families who don't have them. The sanitizing of buildings will happen nightly, so if someone does come up with a symptom, we will make sure that it's sanitized regularly. If they come up with a COVID positive, we would look into having discussions of if we need to increase the sanitation based on what we already have.
This person would also like to know, shouldn't any room or space that had been occupied by a member who is suspected of having COVID-19 be cleaned regardless if they were wearing a mask correctly?
Yes, our new standard operating procedures will be to sanitize nightly.
This person would like to know, or has stated, public schools exist to provide an education to our youth first and foremost. So I'd like to hear how SCASD can maintain the same safeguards outlined in this report for athletics.
Athletics will follow the same safety precautions, face mask and social distancing. If outside, social distancing and a frequent hand washing will be enforced. At a later time, we will address an athletic PIAA plan for return to play.
We have another yellow phase question, and I know we've just talked a little bit about that, but this person would like to know, Governor Wolf allows schools to be in session if our county returns to the yellow phase. Why will SCASD schools close if we choose to do under yellow?
Correct. Again, we're going to readdress that and look into the options, taking into consideration the availability of staff and the infection rate.
Will Penn State interns and other Penn State students be in the schools regularly in the coming year?
All interns will have to follow the same district safety plans with mask wearing and social distancing. In addition, they'll have to follow their university safety plans also. So yes, they will be back.
Okay. And this person would like to know and asks if we could provide more information about how Delta Middle and Delta High will be affected, if differently.
They will not be affected differently. Everyone will be required to follow the safety protocols with mask wearing and social distancing.
How will we support teachers and staff during this period?
Well, we value our staff and have solicited feedback from them, and it's a tricky balance between the individual decisions, so we're trying to work through that. But we're working with the Human Resource Department, which will continue to work with the support of our staff. So the Human Resource Department is actually working on that.
Next question is, how are you going to manage seasonal cold and flu symptoms versus the COVID symptoms? They present very similarly. If a student presents cold-like symptoms but no temperature, how will we handle that not knowing what a student has?
Right. As part of our safety plan, we do have providers on that team, and working closely with them, they recommend that we do quarantine and send home with the instructions that could include possible COVID testing or monitoring of symptoms until symptoms-free, and no fever without fever-reducing medication for more than 3 days.
Okay, the next question is, what will it look like if someone in the school is suspected to have COVID-19? Will the whole school be quarantined, the whole class? How will we know if it's COVID-19 and not something else?
The very reason why we're enforcing the face mask and the social distancing will help us with our contact tracing, and through that we will notify those that were exposed and then provide the sanitizing processes as needed.
The next person says, my son's IEP can't be met online. He can't wear a mask.
Through the is that good? Through the IEP team, we would develop a plan to provide for unique cases. This could include social distancing, where it's feasible, and mask shielding and mask shields and masks for the instructors.
Have we considered the emotional and psychological impact of forcing a young child to wear a mask all day and stay 6 feet away from peers and teachers?
Yes, once the safety plan is approved, we can develop processes to support and provide instructional strategies to help students and staff with the implementation of the plan. This includes supports needed to cope with the changes and the understanding that this can be traumatic, and that we would make sure our staff and students are aware and trained on trauma-informed care.
What types of masks will students be allowed
So
to
there
wear?
are outlines on the CDC website. We recommend the 2-ply cotton, and also a supply of 5 so that they can be laundered or cleaned and wear a different one each day based on the ability to clean them.
And will face shields be permitted for students instead of masks?
Yes, where necessary, based on student and teachers' need.
And that concludes the questions for you, Jeanne. Thank you. Ed, the first question for you, how is the HVAC being managed in response to COVID concerns?
So we're working closely with our engineering advisors to make sure that our HVAC systems are supporting a healthy environment. We are working hard to increase the amount of outdoor air that we get into classrooms. When the outdoor conditions are appropriate, we'll open windows. Most of our rooms have operable windows. We will increase the amount of outside air where we have variable settings, on the air delivery systems. We'll increase that as much as possible. In rooms that don't have operable windows, we're evaluating ways to increase the outside air and air exchanges in those rooms. And potentially we may, in some cases, even bring in portable air treatment systems to help with cleaning the air prior to recirculating it in those rooms. And finally, we'll monitor relative humidity, as this is one of the components that we know impacts the ability of the virus to spread through the air, and try to maintain that relative humidity within the recommended ranges.
The next question, are the walking zones for each school building being increased to reduce the number of students requiring bus transportation?
We are trying to increase walking zones where possible. However, we also have to take into consideration the limitations around unsafe roadways for walking, and we're not going to create unsafe conditions. So we're only going to increase those walking zones where the roadways support a safe walking route.
This person would like to know, since the district will need to social distance on the buses, will more parking passes be available for high school students?
Sure. If we have half of the students, as long as we have half of the students in the high school on any given day, we can increase the number of permits accordingly.
The next question states, the plan mentions asking families to opt out of busing. Will it be possible to opt out of just the morning or afternoon transportation, or will opting out require giving up both?
So as it stands now, we're only accepting opt-outs for both morning and afternoon. Not certain yet how we'd be able to accommodate just a morning or just an afternoon opt-out at this time, but we're going to continue to work on that and consider if in the future we may allow it. But as it stands today, you would have to opt out for both morning and afternoon.
Okay, this next question concerns social distancing in the hallways. How will we distance students in hallways going to and from classrooms?
Well, in some cases, it will not be physically possible to create a 6-foot distance in the hallways. So this is why we are requiring students to wear masks during those periods when they are moving from space to space. But with that being said, we are also working on ways to limit the number of students in the hallways at any given time through scheduling. We are working on, particularly dependent on the grade level, ways to help students navigate the building in ways that would limit contact with other students.
And how are we planning to create 6 feet social distance in classrooms that aren't big enough for 20 or more students?
Sure. So we are currently working with our architectural advisors who have drawings of every room in the school district to create floor plans that would maximize the number of desks in any given room with a 6-foot separation. In many cases, that's going to require moving excess furniture out of the rooms. So typically, in many of the elementary rooms, we would have student desks, but we'd also have kidney tables and other areas created within the room that many of those will be removed from the room so that we can get this separation and maximize those desks in each of the rooms while maintaining the distancing.
Okay, and this is back to transportation. With the increased number of students being transported to and from school by parents, how do we expect to deal with the increased traffic?
Yeah, we anticipate that there would be increased traffic. So we're evaluating ways to increase the time intervals for student drop-off and pickup so that we'd be able to space that traffic out over a longer period of time and have a less condensed arrival and dismissal.
And switching gears again, how will lunch occur under these situations?
So at the elementary level, our food service department is working to package and provide lunch in the manner that could be eaten in the classroom. They are working hard to come up with a good variety of options and food in this scenario, but we are looking at the elementary level to feed the children within their classrooms. And at the secondary level, with the middle school, high school, we would distribute lunches in the cafeterias themselves, and we are preparing plans on how to create the areas for the students to eat that would allow for social distancing during their lunch period.
And that concludes our operations questions. We turn to our elementary education model questions. The first one, the person would like to know, can the elementary school day be shortened?
Thanks, Chris. We're creating a model where students have daily experiences to safely work together and enjoy experiences that they're used to having in our schools. We will use our outside spaces and physically active experiences in our buildings to make sure students aren't sitting for long periods of time.
Next person would like to know, could I send my kindergartner or second grader to school in the morning and then choose to pick them up midday to continue virtual learning at home?
We are providing that option for the kindergarten student.
The next question is, could there be an option for elementary children to attend every other day learning as well?
Well, that isn't built into our plan. So, we are planning for every day because we're safely able to do so in our elementary schools and because that's going to best support student learning.
The next question, will the elementary students be required to wear their masks for the whole day? And how will teachers be handling the implementation of the mask wearing?
Well, everyone in our schools, staff and students, will be required to wear masks to support the safety and health of our entire school community. Students will be able to remove their masks while outside and maintaining social distancing.
How will elementary school students be socially distancing when arriving in the schools and classrooms?
Well, we are working with transportation to possibly stagger those arrival times, Chris. And as students are walking into class, faculty and staff will be in the hallways to support that students are wearing masks, as well as during that transition into buildings, because it's less than 15 minutes, our safety plan does enable social distancing to be less than 6 feet during those transitions.
Very good. This next person would like to know, will elementary children still have recess?
Absolutely. Students will have recess while physically distancing without masks. We are providing flexibility for more physical activity and recess. Initially, playground equipment will not be available, but we will continue to evaluate that on a 2-week basis as we move into the fall.
This person would like to know what happens if our young child will not wear a mask.
Well, we are requiring that all students and staff wear masks to keep everyone safe during in-school experiences. After the plan is approved, we will be sharing resources to help families prepare their children where those concerns do exist.
Will students be sharing classroom materials?
No, students will have their own learning boxes in our elementary schools and will not be sharing materials.
This person would like to know, my big question is, have you consulted the kindergarten teachers? Have they voiced their thoughts with this plan?
Yes, we do have kindergarten teachers on our educational model team and are exploring developmentally appropriate experiences, including frequent breaks and small group instruction. We recognize that in-school experiences will be different than in the past, and it's not going to be perfect. However, we believe that it's important to have elementary school students in school every day. In regard to the safety parameters, Chris, just to be clear, the safety plan, as I said earlier, is being developed by a group of professionals that have been working throughout our community and studying the virus for many months. We haven't asked teachers nor administrators like myself to develop the key parameters, which are constraints that are in the plan due to safety reasons.
Will we increase the number of classes per grade as needed? For example, last year in 4th grade, my son's class had 26 students.
Well, if we have grade levels that exceed 20 students, then we are looking at having some of our classes relocated within the building to larger spaces that permit the 6 feet of social distancing with a number greater than we can have in that particular classroom space.
Very good. The next question is, will there be regular specials in the elementary schools, STEM, library, music, art, and gym, and what will those specials look like in the cyber school?
Well, in our schools, yes, specials will be offered in both options, as well as the cyber, or virtual academy. And in our schools, these teachers will be coming to classrooms to offer the specials. That's our plan at this time.
For K-5 virtual learning, will there be significant synchronous instruction, or will it be self-paced like in the spring?
Well, we are prioritizing synchronous learning for K-5 students, but we will also provide flexibility to students and families to work at different paces where desired.
Turning to a music question here, will the instrumental music program in the elementary schools continue as in the past? Is there an instrumental music opportunity for the virtual academy? If not, what will happen in upcoming years for a child who has missed a year of instrumental music?
Well, I can tell you that we will prioritize some type of music experience regarding instrumentals for students that are in the virtual academy. We just don't have that finalized, so I can't respond in full to that question.
Turning to a math question here. In 3rd to 5th grades, kids mix and regroup for math. Will that still happen daily?
Right now, for the first unit, we are considering that students don't regroup so that we can use this time to assess students. Obviously, we were out for the spring, so that we can make informed decisions for any regrouping in future units then.
This person would like to know, what will the virtual academy look like for grades K-5?
Well, first, I want to point out this program's nothing like what we offered in the remote experience in the spring. However, SCASD teachers will be supporting students in their learning while they're working in an online learning management system. These teachers will also utilize tools such as Zoom. Teachers and counselors will also support students with their social and emotional development through regular online experiences.
Very good. This person wrote, for elementary age kids, can you choose to pick one or the other option for learning? And if it's not a good fit, decide to switch. I just want to know if you're locked into the decision that we have to make.
Well, we're asking parents to make a commitment on the front end of this. For elementary, it's for the first trimester, which is about Thanksgiving. For secondary, it's for the first semester, which transitions in January. Having said that, if somebody makes a decision and wants to be in the virtual academy and then switch into our in-school experience, that's a more difficult transition than vice versa. So the answer is yes, if there's space in our in-school classrooms with our faculty. It's easier for us to make a transition from an in-school placement into the virtual academy. So I believe that answers your question. We're hoping that people are making their decision, and then we'll make changes easily available during the trimester switch, change, or at the end of the semester for secondary.
We have our final elementary educational model question. This person wrote, remote learning was not sustainable for my family in the spring. Virtual academy will not work for my elementary age children if I'm required to be at work in person. If I choose to send my kids to school in the building and we end up being remote, are there specific differences that have been designed around remote learning to improve on the spring emergency remote learning?
Thanks, Chris. Well, one of the reasons why, the parameters from the health and safety plan are being developed the way they are is being in school is something we want to do for as long as we can. And we believe that our fidelity to those safety measures will allow us to do that for a longer period of time than if we don't follow that, obviously. If we do have to close schools and shift into a remote model, I just want to say that this spring, I want to use the term emergency remote model because we developed that over spring break, and it was fast, and we weren't prepared to do that shift. However, we've learned a lot. We've surveyed families, faculty, and secondary students, and we have teams of faculty and principals working with our curriculum directors as I speak, and they've been doing this for weeks, reflecting on all of the feedback from those groups to make a better remote plan for the coming year should we need it. So if we are required to close schools, it'll be a much more robust learning experience with higher expectations for all of us than what we experienced in the spring.
Very good. These following questions concern the secondary educational model. The first one, some people are saying that high school students will only have A-day classes in the fall semester and only B-day classes in the spring semester. Can you clarify what the schedules will look like?
Well, that is correct. Students at the high school will have 4 blocks or 4 classes at a time, and we'll be working on those classes each day for the semester. So for year-long courses, A-day classes are going to happen or occur in the fall semester, and B-day classes will occur during the spring semester. And our reason to do that, which many high schools do have a semesterized system like this, but our main reason was to reduce contacts for students and faculty as part of our safety plan implementation, but also to help if we are in a remote status later in the year, at any point during the year, to make the number of communications for families and students and faculty more manageable. That was one of the feedback points from the spring, that people felt pretty fragmented by all the communication. So those are some of the reasons behind that. Students will be divided into 2 cohorts by last name and alternate their in-person days in our buildings. Students will be able to take all of the courses that they've requested. On the day students don't come to school, they'll receive work from their teachers to extend learning, preview upcoming information, or engage in projects. 6th grade students, their classes will not run on the semesterized block schedule. Their classes will be year-long, with students coming to school every other day, as we stated. Because 6th grade does operate differently, it does have many of the components of 5th grade as well, and they don't experience as many transitions as 7th through 12th grade students.
For families with multiple children in high school, could the district pay attention, please, to make sure that they are going to school on the same days to aid in coordination for parents?
Absolutely. We are planning for siblings to attend schools, secondary schools, on the same day for in-school learning. Students with the last name A through L will attend one day and M through Z on the other. That's what we're planning at this time. Obviously, we have to work through how that change gets implemented through the schedule changes, and also monitoring how many families opt for the virtual academy. If siblings have different last names, our counselors can adjust those in-person days so that families do have that experience.
Very good. This one concerns AP classes. How will the proposed schedule work for AP classes, which give a comprehensive exam in May?
Well, because we have offered some AP semester courses in recent years, we have some experience with this. So the College Board, although we will continue to look to them to make a change, they have not made a switch to offer mid-year testing to date. For spring exams, teachers will offer review sessions to help students prepare for those AP exams.
This person would like to know, has a question about the virtual academy. For secondary students, including the Delta program, will all courses, with the exception of hands-on electives, be available through the academy?
Well, no, not all of our SCASD virtual academy options are the same as our in-person offerings, especially as you mentioned, many of our CTC or Career and Tech Center programs.
Next question is, if a student chooses in-person instruction and must transition to remote due to illness or school closure, will they be moved to the virtual academy, or is there a different remote option that the in-person instruction students will be doing?
Right. Well, for students who choose the in-person option and become ill or need to quarantine, our plan is that we'll provide them with assignments and resources to help keep them up to date, as well as obviously have their teachers supporting them while they're out. And this could happen with teachers too, so we have to have flexibility for students and faculty. So one of the positives out of our challenging spring is that we've learned to work remotely both as faculty and students, and so we're prepared for this in either case, and where possible, the teachers are going to use Zoom to help with synchronous instruction to the student during that period of time.
Very good. The next person asked 3 questions. Let's address them separately. The first one, is the virtual academy the same as the remote portion of the in-school instruction?
The virtual academy that we're implementing is not the same format as the remote learning experience, but it is designed to be mostly self-paced and flexible based on where each student is in their program. A certified State College teacher is assigned to help the student, as well as grade the work and give feedback and support them through some of the challenges where they need support.
Sure. The second question, could a student switch between virtual academy and in-school instruction at any time?
You know, as I said in the elementary question that was similar, for families who enroll in our virtual academy, we're asking for a semester commitment. If we do have seats in the requested courses that are in our in-school experience, we'll go ahead and honor that transition from virtual academy to in-school prior to January. Like we said earlier, our plan is to offer transitions at the mid-year point where we have the semester transition, because that would enable us to also reassign faculty.
And could a student who starts in person switch to the virtual academy, going the other way?
Yeah, yes. That transition from in-person to the virtual academy would be a little bit easier for us, so we would honor that transition.
Very good. This person asks, what policies will be in place if I decide to send my child to school, high school in September, and cases spike? And this concerns remote learning.
Well, if cases spike and schools close, and there are several factors, and we're looking at that with our health and safety plan team, as well as our community leaders within the health and emergency management roles that we're collaborating with. You know, in the case where if we make that decision to close schools or have schools closed by the governor or the state, we will move into remote learning for everybody. In the spring, we pulled that together, as I said earlier, in an emergency manner. It was fast, and we weren't prepared for that. With that said, we learned a lot through the spring, made improvements on the fly, and now that we've had the entire month of June to look at, most of the month of June, excuse me, to look at the feedback from parents, students, and faculty, you know, the teams of teachers and principals working right now that I mentioned are using that feedback to create a much more robust plan for us if needed during the coming year.
We have two more questions. The second to last question says, Delta Middle and High are both under 250 students. Are they also planning to alternate days in school with virtual days?
At this time, they're not. You know, Delta's also on alternating days in order to follow the physical distancing guidelines outlined in the draft of the safety plan.
And our final question, what is the plan for secondary in-person extracurriculars, also physical education, also music?
Well, right now, we don't have answers to these questions yet. But when we do so, we will communicate those.
That concludes our questions. Thank you.
Thanks, Chris. Our reason for, you know, having the parameters, which obviously are a challenge for carrying out our in-school experiences, our reason to have those developed by our health and safety professionals is that we're working to create a safe environment for our students and employees to come together and create loving and caring school communities where we're focused with students and families on developing the young people of our community. Once people come into our schools, we want them to know that we're adhering to what the health and safety professionals told us to do. So that's my role and our administrative team's role to keep our students and employees safe. So that's the first step, and following our board's approval of the health and safety plan, we will further flesh out our educational model. The state's Department of Education requires that approval, and our focus over the last few weeks has been preparing the best plan for our board to consider prior to moving forward and asking families to commit to our in-school or our virtual academy options. In the near future, we'll be sharing more information about our educational model plans for elementary and secondary students, and then we're going to ask families to commit to enrolling their children in one of those options. We're also going to ask families to do what they can to help us with our transportation challenges. With the distancing requirements on us, we're going to need as many parents and guardians to help transport students to and from school. And the more parents that help us with that, the more we're going to be able to implement what we've shared today as our in-school experience. So I appreciate everyone for joining us today to engage in this important update, and I also appreciate members of our team who helped us prepare all of the information, as well as Jeanne and Ed for coming out and sharing their work to date. Thank you.